good evening. Okay, so this is going to be the proper use of PPE, which is personal protective equipment. So you're going to go ahead and start off by making sure you are dealing with the correct patient. You want to go check the MRN number, check if you have the correct client. You want to check if they have any precautions, any isolation precautions that you may need to be aware of. In this case, our patient does have isolation precautions in place. So you would go ahead and gather all your supplies and before you plan to head in there. Also, you want to make any visitors, families, or friends, you just want to educate them, kind of let them know if to use that protective equipment, that PPE, just making sure that they're also following protocol for their safety. So we would go ahead and start off by sanitizing our hands, proper hand washing. Also, you want to let the hand sanitizer dry before you put any of your gloves on towards the end. We're going to start off by putting our gown on. Also, some of these gowns are hard to tie, so if you want to just tie in the back, that's perfectly fine. In this case, I am going to do that, or you can tie in the front and kind of put it over your head and make it easier. That's fine as well. Same for your waist. You can choose to tie in the back. I choose to tie in the front. It's just easier for me. Now we're gonna move on to putting our mask on. All right, I'm gonna go ahead and tie at the top, make sure it's nice and secure. Also, you want to go above your ear. You don't want it to go below. Just kind of securing that mask. Same with the bottom. You just want to go ahead and tie it down below around your neck. Not too tight, but secure enough. Next, we want to put on our protective eyewear, which in this case are our goggles here. We'll go ahead and put those on. And then we want to put on our gloves. Now, when you're putting on your gloves, you want to make sure it goes over that cuff of the gown there. All right, perfect. Next, you're going to be going into the room, so you just want to make sure you verify your patient's name and date of birth, making sure you're dealing with the correct patient. You also want to let them know of any procedures or exams that you're going to be doing with them. Okay, and then once you finished up, you want to go ahead and remove your PPE, whether it's in an anteroom or anything of that sort. So you're going to start by untying your gown here in the front, if you have it tied in the front, which I do. Then you want to go ahead and remove your gloves. You want to go ahead and pinch with the opposite hand, taking that glove off, putting it in your palm. With your other hand, you want to go under where you're touching your skin and pulling that glove off. Okay, you should then dispose of that. Then you want to go ahead and remove your goggles. You want to go ahead and grab behind by the ears without touching the front of the goggles and contaminating. All right. Next, you want to go ahead and remove your, you want to go ahead and untie your gown here. Go ahead and untie that, making sure you get the right tie there. All right, so then you want to go ahead and kind of have it fall away from you. If you can, kind of shimmy. Okay, now with these gowns, it kind of cuffs at the wrist. So you want to go ahead and go in your gown without touching the outside and kind of push that off. Okay, without flipping it on the inside. Once you get on the inside, you'll be able to pull this part off and then kind of just let the rest shimmy turning it in. All right, and then disposing of that. Then you want to go ahead and remove your mask. So you want to go ahead and untie those straps without trying to touch the front and dispose of that. Okay. You want to discard in any waste container that they may have for isolation or the trash. And then go ahead and perform hand hygiene one more time after immediately removing all your PPE. And that's using PPE. Thank you.